Okay, breaking news just into our newsroom. This is within the last 15 minutes. In an emergency meeting, Rhode Island's COVID-19 vaccine subcommittee voted to officially recommend hospitals can begin vaccinating with Pfizer's COVID-19 vaccine. 12 News reporter Alexandra Leslie was listening to that meeting within the last hour or so. She joins us now with the breaking details.
Well, Patrick, this is truly a historic moment for Rhode Island, and it means any moment now the first vaccine doses may be administered to some high-risk healthcare workers, the hospital staff that's been working on the front line of this pandemic for the last 9 or 10 months. Now, the subcommittee's vote comes after 2 independent advisory committees, one to the FDA and one to the CDC. Both voted last week to recommend Pfizer and BioNTech's vaccine for emergency use. This morning, Lifespan told us its first shipment of 3,000 doses had arrived, and it will begin vaccinating workers today. Specifically, this will now mean high-risk staff 16 years of age and older who do not have a history of anaphylactic reaction to components of the Pfizer vaccine. Now, the subcommittee said that Rhode Island Hospital and Newport Hospital would be receiving shipments today. Then tomorrow, Kent Hospital, Women and Infants, and the Miriam Hospital will be receiving their shipments. The subcommittee said the remainder of the vaccine supply will be in all Rhode Island hospitals by Thursday. Live in Pawtucket, Alexandra Leslie, 12 News.
So vaccines also set to arrive beginning today all across Massachusetts. Many hospitals, including some in southeastern Mass, have plans in place already to begin vaccinating their workers very soon. RICCI live in Fall River this morning with a look at that timetable.
Well, sometime this morning, that's when it's supposed to begin, Patrick. About 2,000 doses expected to arrive at the South Coast Hospitals Group across their 3 hospitals, including Charlton Memorial here in Fall River behind me. Now, the first step is setting up those vaccination clinics, which South Coast Hospital Group says that they have already done here at Charlton, at St. Luke's in New Bedford, and at Toby Hospital in Wareham. They'll be operating those clinics 16 to 17 hours a day. Next, the hospital group has prioritized its workforce, it says, putting staff members most regularly in contact with COVID patients at the front of the line. If everything goes as planned, the VP of Operations says they're expected to dole out all 1,950 doses of the vaccine by the end of this week.
It hasn't been real clear what the ongoing allocation will be, but we know that we need to use the vaccine that we're given in order to receive additional allocation. And so our goal is really to get as many people vaccinated as quickly as possible so that we can protect our workforce and so that we continue to receive allocation because once we get through our healthcare workers, then we can move on to other essential workers in the community and patients at high risk.
And those additional allocations will be essential because don't forget this is a 2-dose vaccine. So everyone who receives this first wave of vaccinations will walk away with an appointment to come back 17 to 21 days later for that second dose. That's the latest live in Fall River. Ricci, 12 News.